The U.S. is tracking a spike in COVID-19 cases, and officials say a surge of the Delta variant, first identified in India, is to blame. According to the CDC, the Delta variant accounts for 1 in 4 COVID-19 cases in the U.S., and it's now the dominant strain in 5 states, including California. Officials are also expecting another rise in cases after July 4th celebrations over the weekend. Of course, we're all gathering together, often in close spaces. Meantime, the American Academy of Pediatrics says children now make up more than 24% of new weekly COVID-19 infections. That is compared to the start of the pandemic, when they accounted for just 2% of new infections. Dr. Dyan Hes is with us now to discuss. She is the founder of Gramercy Pediatrics in New York City. Doctor, great having you here this morning. I hope you had a good long weekend. Dr. Hes, how concerned are you about the spread of this Delta variant, and what do parents with unvaccinated children need to know?
Well, I'm concerned that enough adults are not taking the vaccine, and that's why it's spreading more and more. So if you're, let's say 60% of the adult population, like ideally would be vaccinated. That's not even happening, but let's say that. Like, where is it going to go? It's going to go to the children. Who are they usually getting it from? They're getting it from their caretakers. So we found that it's not really what everybody thought, that the children are giving it to the parents. It's that the adults are giving the virus to the children. So we need more adults. We need to do better getting the adults vaccinated to protect our children. Luckily, the Delta variant doesn't seem more virulent. It just spreads quicker. So, maybe it's just going to blow through over the summer, and hopefully more kids will actually have immunity, from catching the disease in some sense. So that might be the silver lining if it's not as bad. The truth is that I can do a COVID test on 100 patients. I don't know who has the Delta variant or not. They don't tell the physicians. So it's very hard for me as a physician to say, is this patient more sick because it's a Delta variant? Is the patient more sick because it's a different strain? What I really think also is that we do not require the vaccine to enter the United States. If I want to go to other countries, I have to show that I had the vaccine. Why is it not the same here? I think the U.S. should make the vaccine mandatory for adults who are coming to this country.
Let me ask you a question, because, I'm fully vaccinated, my husband is fully vaccinated, but we have talked about, some people getting these breakthrough infections, or that the vaccine, protects you against serious illness, which means, and you can clarify if I'm incorrect, there's a possibility that I could get COVID-19, not know about it because it doesn't affect me detrimentally. But does that leave my daughter vulnerable then? And so perhaps when I go out and about, should I be masking and staying away from people, even though I'm already fully vaccinated?
So right now, they say that if you're fully vaccinated, you don't have to wear a mask. The probability of transmitting it is low. This is all, remember, this is a very new virus. We've only had it for 18 months. So we don't know exactly. But right now, we don't think that people who had the vaccine are super spreaders and are giving it to other people. Just remember, when you have the flu vaccine, it doesn't mean you're not going to get the flu. It means if you get the flu, you're not going to be the one ending up in the hospital with a secondary pneumonia or death. Same thing with the coronavirus vaccine. And I think that's a hard pill for people to swallow. It doesn't mean you're not going to get the virus. It means that if you get that virus, you hopefully and most likely will not end up in the hospital and not dying from COVID.
Okay, so explain this to me. So Israel reports that although Pfizer's COVID-19 vaccine variant continues to prevent severe illness, its overall efficacy is declining with the emergence of the Delta variant. I don't know if I quite understand how that works. Why would the overall efficacy of a particular vaccine be declining if it generally, is a protection?
Well, you have to remember, Israel rolled out the vaccine before everybody, so they're the ones with the most data. They also have a much greater elderly population, and that's who is mostly vaccinated in their country, so they haven't really rolled out the 12 to 18. So the patients who are getting the vaccine in Israel, or the adults, are mostly the elderly. And I think those are the patients with the waning immune system. That's just my personal, they haven't published all their studies yet. This is just what I'm thinking as a physician. So it still doesn't mean that they're not, it doesn't mean that the vaccine is not efficacious. It means that they could be getting the Delta strain, which it wasn't designed for this vaccine. We hope it was give coverage, but it didn't exist when they designed it. And that these same patients might end up with COVID, but they won't end up dying from it. So that's what we have to watch. And I do know that Pfizer is conducting booster trials. I have a friend who's in it. So, this is an evolving science, and we have to be amenable to that. Not everything is 100%, that things change daily. And I think that's what we've talked about this before. This is what frustrates people, because they get upset that the science is wrong or they were lied to. It's evolving. We're learning every day.
Okay, so speaking of protecting kids, Johnson & Johnson says that its single-dose vaccine is effective against the Delta variant. It hasn't begun trials on kids between 12 and 17, though. What's your take on the timeline? They say they probably won't begin the trials until fall. Do we expect to see J&J file for an emergency use authorization for people under the age of 18?
They probably will, but I think it's going to be a very big uphill battle and a PR campaign for them after the clotting issue. I think that people have more faith in the Pfizer and the Moderna just because it's been, tested and people see their friends have gotten it and there hasn't been this bad press about it. So, we'll just have to wait and see how the trials go. I think that's, we can't predict the future, but we'll have to see. I think they're going to be harder pressed to get people enrolled into their trial.
So the Hawaii Department of Health released its latest report on the spread of COVID-19. And what it revealed was there were outbreaks in home-based child care. Can you explain the risks here?
Yeah, it's just close quarters. It's exactly what we saw in New York City when we were at the peak of the pandemic. Where did people get the most, virus explosions? In what neighborhoods? In places that people lived in close quarters together. So in like communal housing, when you live with multi-generations, home daycare is usually like a grandmother, a mother, and babies. So it's going to be in this close, in one room or a basement of a house. This is how COVID spreads. It jumps from person to person in very close quarters. And usually in daycare, those kids are not wearing masks. So if one of the caretakers has COVID, it'll probably spread through everybody. That being said, hopefully these kids are going to do fine. Time will tell.
Right. Dr. Dyan Hes, always great talking to you. Thank you.
Take care.